Good morning, everyone. We're happy to be here as Kenya Medical Association to give our perspective in terms of human resource for health issues in terms of the value chain. So I'll just be making a small presentation. Issues of human resource for health are cross-cutting, and we cannot be able to discuss it in the next 10 or 15 minutes, but I think during the panel discussion then we'll delve deeper into it and see how we can work together in the industry to address most of these challenges. Next. So as Dr. Nyalita has introduced, my name is Dr. Andrew Wewe. I'm a consultant plastic and reconstructive surgeon. Recently graduated, just cleared in August, so she's correct. I'm waiting for my graduation in December. I'm also a fellow in capacity building for effective health, HRH. This was a program that was supported by a German corporation that we did way back when I used to serve in the union 2012-2013, where we were able to go around in different countries and compare the health systems. And I think this is a time when the UHC agenda was being introduced. I'm also the chair and founder of Daktari Media Africa, which runs Daktari Online, which is a leading continuous medical education platform, now serving all healthcare professionals, from doctors, nurses, pharmacists. We're also in Francophone countries, Nigeria, Ghana, Ethiopia, basically in Africa, and we hope to be a leading company in terms of that. And we are also launching our virtual care platform for telemedicine as Daktari Online. Thank you. Next. So I was asked to discuss about HRH issues, the value chain, and I think for any country to meet its health goals, it depends largely on knowledge, skills, motivation, and deployment of responsible of people responsible for organizing and delivering the health services. And from number of studies that we've been able to do, there's a direct correlation and evidence between the positive link between the number of healthcare workers in the population and the health outcomes. And as a country, we have continued to lag behind in terms of training of healthcare professionals. I avoid using the term healthcare workers because in healthcare workers only look at the clinical aspect of it and not the auxiliary support that the industry needs to be able to be effective. So many countries, however, lack the human resources needed to deliver essential health interventions. And this is because of a number of reasons, which range from limited production. There's also migration of health workers. I'm sure most of you have seen lately, but Kenya now exporting nurses to the UK, despite us having critical shortage of nurses in our country. And even before nurses started going out, we have a lot of doctors who have left the country and other healthcare professions, mostly. If you look at the health sector in Southern Africa, Botswana, Namibia, Lesotho, they're all run by healthcare professionals from this country. The issue of also poor mix of skills and demographic imbalances continue to pose a challenge in terms of delivery of health services in this country. And on top of that, we don't have a well-constructed health financing policy or strategy, and also the HRH policies and legislations are still need a lot of input, and I think that is where as KMA will be very instrumental working with other partners to ensure that that is addressed. Although I think in the last week, the health financing strategy has been developed, and I think it's just awaiting formal launch, which will help guide us in the way we need to move forward. So in terms of the healthcare workforce, and this, I keep on insisting, it encompasses all people that are engaged in actions whose primary intent is to enhance the health delivery in this country. And this includes both the clinical and non-clinical staff. Key, and it's a conversation that now is coming into play, is the issue of management and support staff in terms of ensuring that the health system functions as effectively as it is. But I've had a lot of noise from associations in terms of the governance of the health institution. I know this is conversations that we've been having, whether we should have healthcare workers who are trained in healthcare management taking lead in this, or whether we should open this to lawyers, economists, and other business people to be able to manage our facilities. And in that end, we still insist, and there's a study from McKinsey that says, that was done in the UK NHS, that showed evidence in terms of people who are healthcare workers, we have a healthcare background, and then they're trained and capacity built to be healthcare managers, they're found to be more effective in the management of the health system. And I know this is an ongoing issue in Parliament, where the Health Amendment Bill of 2021 seeks to remove the healthcare workers from that arena, and it's something that we strongly feel the government should look at, and we consider that particular move. So as we speak, there are no comprehensive and robust methodologies in place for assessing the health adequacy of the health workforce to respond to the healthcare needs of this particular population. I know the last one that was done was by the JICA funded, and that was almost 5 years ago. And I think after that, we have not been able to go back to the counties and our national government and try to accurately assess the needs in terms of the health workforce that our market needs to be able to have an effective health system. So in the low middle income countries, we still have, according to WHO, our ratio of healthcare professionals is still as low as 23 to 10,000 in the population. And this cannot enable Kenya to meet its SDG priorities. So, but I think that is one area in terms of the health workforce, in terms of training and doing a need assessment, that we need to actually focus so that we can have properly trained healthcare workers with a good skill mix to be able to address the needs in the market. One interesting thing that we keep on noticing in terms of, right now as we speak, we have more than 2,000 medical officers who are out of formal employment. And yet we are still using the same strategies that we used in the 70s and 60s to address the health workforce needs. Because if you look at it, I won't mention specifically, we need to stop training some cadres so that these 2,000 doctors can be able to fill that gap. There's always this term where we're saying in Africa is we're trying to have a workforce for the poor, and that is not focused more on quality. And I think it's about time that we look whether some cadres are being bypassed by time. Instead of having degree level and master level of those cadres, then we go back to the drawing board and start looking why were they trained? Why was there a need to have these cadres in place in the 70s and 80s? Whether we still need to have them now, or we need now to focus on training of doctors to ensure that there is quality delivery of healthcare in this country. Next. So there's a need for comprehensive, reliable, and timely information on the human resources for health. This is the numbers, the demographic, the skill sets, services being provided, and factors that will influence, especially the recruitment and retention. And this has been widely identified at international, regional, and national level, and you've been seeing the civil societies in the health sector speaking about this issue again and again. I think it's about time, as we move towards launching of the universal health cover, that we do pay key attention through this. So this has become even more urgent in the international effort to scale up education and training of healthcare workers, mostly in the sub-Saharan Africa. And you see, currently in Kenya, we still haven't figured that out, especially if we look at the training of the doctors, where we are still not sure whether we go the fellowship way of training or we stick to the, I call it the unsustainable university-based kind of training, which I'm a product, which does not really ensure that there's a good environment for training of that healthcare worker and that he comes out fully baked. But I'm not saying I'm not fully baked. I'm just saying we need to really look at whether the fellowship one is we need data to inform us whether we go the fellowship way or we go the university way training in terms of the training of the health workforce. The health worker density, the number of health workers per 10,000 population per cadre, is normally an indicator of the most commonly reported international. Internationally, it presents a critical starting point for understanding the health system resources situation in this country. And I keep emphasizing on this point because even the data that we have locally has not been updated because counties have continued to hire. So most of the information we get is from a national level, but we need to have that data coming in. And I know from the research from SBS, we can be able to get this, and so that we can properly inform the regulatory bodies and the Ministry of Health in terms of the way we need to go to address the HRH to face. Next. So there's also an increasing interest globally in equity in the health, and the pathways by which inequities arise and are exacerbated, and the imbalance in the supply, deployment, and composition of human resources for health is an ongoing concern, and we need both the social and political interplay to come into a force in our country, especially in Kenya. Currently, as we speak, we have around 15,000 registered doctors by KMPDC. But if you look countrywide, more than 80% of those in active practice are actually based in the major urban centers. And that, we say major urban centers, basically speaking about where MTRH is in Eldoret and in Nairobi. So we find that people still, even 10 years after the evolution of the health services, people still have to travel to Nairobi to seek health services. As we speak, I'm traveling over the weekend to Makindi to provide a service, which if we, in plastic surgery, which if we planned well, then we could be able to have the sharing. And I think this is something that was supported by World Bank, where we need to find a way, because you have very few specialists in this country, how we can share them within counties and have counties pay for that service so that we have the imbalance in this country addressed, because there is no need, you have devolved health sector, but you still have to travel to the capital city of Kisumu, Eldoret, Mombasa to seek the same health services. Next. So drawing on an analytical framework for understanding health workforce imbalance, at least 4 typologies for monitoring and distribution of the health workers should be considered. One, the imbalances in occupation and specialties, and this cuts across the health care professionals, from the doctors to the nurses, where during the COVID time we were very exposed. We had ICU beds all over by the MS system, but yet we didn't have ICU nurses to man those facilities. Issue of dialysis, you still need to train renal nurses, and still haven't really prioritized on this specialized kind of training for our health workforce. Geographical representation in terms of equity is important in this country, so that we ensure each and every person in any corner of this republic then has access to the kind of health service on demand. Institution strengthening and the services. Of course, in the media you've seen one of our key leading institutions almost tripling the cost of specialty training, and that affects us directly, because we are a country that we have a lot of shortages in terms of specialist training in this country, while one of the leading institutions goes ahead and decides to, without proper stakeholder consultation, to actually put barriers in terms of meeting those needs. So I think we need to sit down with the training institutions, regulatory bodies, Ministry of Health, Ministry of Education, so that we can come up with a comprehensive strategy in terms of addressing the HRA challenges that we do face. So it should be based on the national county needs. So the problems you have now in the industry, you are trying to summarize all of them, is one, training of health workforce is not based on the national county needs. There's lack of enough funding towards the training of a competent health workforce. We still have human resource for health shortages and management challenges, governance issues at a county level. And I think this was because of the speedy devolution of health without properly training the county health managers in terms of how they should be able to handle this stuff. And then also our policies and legislative framework are not supportive of the HRH market needs, and we need to ensure that the strengthening of the civil societies, KMA, and the other associations that ensure that they're able, their voice is able to be heard in terms of meeting these needs. So we need the staffing norms and needs assessment for Kenya to be updated, because I know there's some documents and policies that exist in the Ministry of Health. There is need to allocate enough funds. That's not only for training, but also to the health sector. We still, last year's budget was around 3% allocation to the health sector. And we are signatories of a budget declaration that at least guaranteed a minimum of 15% of the budget. So we need to have this conversation. Other than that, there's need to ring-fence the health funds, especially that are coming to the counties. Because what you're seeing in the counties, once the funds are allocated, then you find they're being directed to other priority areas, which is affecting the addressing of human resource challenges that we do face. Ministry of Health also needs to take its place because issue of policy and standards is still at the national level. But we are seeing in the field that is not being taken up by the counties. So I think we need to have Ministry of Health or the national government stamp its authority in terms of setting standards and guidelines, because that is the role of national government and not county governments. And around here is where you're hearing discussions of whether counties should be allowed to procure directly outside the KEMSA framework. If that happens and there are no proper policies and guidelines to guide that, then we all know which country we live in and the impact that it will have in the health sector. Let's go back one slide. Yeah, next. So create an enabling environment for healthcare professionals to effectively perform their duties. And enabling environment means at the workstation and at those particular counties, so that we can have the healthcare professional comfortably going to work in Mandera and has all the utilities available, both at the workplace and to support him also socially. So these are the pull and push factors on the ground, and these we need to look at it as we look at the human resource for health workforce issues. The policies and legislative agendas, we need it to be expert driven. I cannot emphasize on that point, because we're in an era in Kenya where everyone else knows what is best to be done in the health sector, other than the professionals in the health sector. So we are being sidelined. People are coming with all kinds of ideas without proper consultation of the professionals themselves, and this is our trade. We are trained in this. In as much as we might need that working environment or that support from other sectors, but we should not lose the voice of the expert, that person who was trained to be a healthcare worker, in terms of how we need to address the challenges that we face there. Issue of regulation, strengthening and separating regulation of service and professions in the sector is also a key recommendation that you're making in terms of dual regulation, where we want to move, for example, from separation between service and professionals regulation, where right now it's mixed up, and we have seen that in the pharmacy industry. We have also seen that in the medical industry, where there's need for that. And lastly, we need to create a forum for continuous dialogue with the healthcare professionals to avoid unnecessary industrial strikes and disharmony in the sector. Thank you.